Hello, my name is Alistair, and I will be presenting variability of ADC estimates between scanners from whole body imaging is dominated by within scanner variance. I would like to thank my co-authors as well as my funder, the EPSRC. I have nothing to declare. Diffusion-weighted MRI has the potential to be used as a quantitative imaging biomarker in oncology, where impeded diffusion and hence lower ADC value correlates with high cellularity associated with tumours. So, why is it that ADC still hasn't been adopted as an imaging biomarker in oncology? Well, to be a useful quantitative imaging biomarker, it should demonstrate reliability in order to be able to determine meaningful changes in its value over time to allow for critical decision making with respect to treatment or therapy response. Unfortunately though, there is a lack of data evidencing the reliability in whole body imaging. Therefore, the aim of this study is to quantify and compare the within and between scanner variance of ADC measurements in whole body imaging. This will hopefully inform the most appropriate strategy to improve the reliability of ADC estimates, which in turn may lead to help to its adoption as a quantitative imaging biomarker and therefore improve treatment decisions in patients. In this study, 10 healthy volunteers were scanned on 2 different 3T scanners. On each scanner, each subject underwent test-retest whole-body diffusion-weighted image examinations at 2 b-values. This corresponds to 4 scanning sessions per volunteer. Acquisition parameters used for both scanners were kept as similar as possible, hardware and software permitting. The ADC maps were calculated from the 2 b-values on a voxel-wise basis using the same mono-exponential fitting algorithm for both scanners. Circular ROIs were placed in bone, liver and brain tissue. Care was taken to select a homogeneous signal region without blood vessels or recognizable artifacts. The mean ADC for each ROI was then compared between scans to determine reliability. The agreement of ADC measurements between and within scanners was assessed according to the Bland-Altman methodology. The 95% repeatability coefficient was calculated for each scanner. This is the value that you'd expect 2 readings of a subject taken on the same scanner will be within for 95% of the subjects. These are shown for each ROI along with their 95% confidence intervals on the graph. The values for the Philips scanner are given in purple and the values for the Siemens scanner are given in green. The 95% reproducibility coefficient was calculated between the scanners. This is the value that you'd expect 2 readings of a subject, 1 examination taken on each of the scanners, will be within for 95% of the subjects. And this figure shows both the repeatability and the reproducibility coefficients. So for each ROI, the confidence intervals for the repeatability and reproducibility coefficients overlap, showing there is no statistically significant difference. The coefficients were all lowest in the thalamus, with no overlap in confidence intervals for any ROI outside of the brain. In conclusion, there was substantial within-subject variation in extracranial ADC estimates both within and between scanners, as measured by the 95% repeatability and reproducibility coefficients. The similar magnitude of variation observed within and between scanners suggests that the main source of variance within a given tissue type is between scan variability within a scanner. Our results therefore suggest that to improve the reliability of whole-body ADC estimates, a method to reduce the within-scanner variation is required. Thank you for listening.